Symptomatic treatment. Well, here you can have either local treatment directly, yes, or general treatment. But in principle, oral herpes still needs to be treated systemically, right? The treatment should be comprehensive, a holistic approach. First of all, such local treatment involves the use of a dental gel. This is Holizol gel. It works in various ways as an antiseptic, as an anti-inflammatory agent, and above all, as a pain reliever. It is applied 3 times a day. And in fact, very good results are observed after its use. As a specific therapy, non-steroidal anti-inflammatory drugs can be used to relieve pain. This could be Nimsil or ibuprofen. In addition to this treatment, specific antiviral therapy is also prescribed antiherpetic medications such as Zovirax or acyclovir-gaviran. They are usually taken for 5 to 10 days at a dose of 400 milligrams 3 times a day after meals. At the same time, a group of vitamins A and E is always prescribed to promote better epithelialization of the mucous membrane. In severe cases, other antiviral drugs from a different class are recommended, such as Famvir. It is prescribed at a dose of 250 milligrams 3 times a day, typically for about a week. As for Valtrex, Valtrex is also used in severe cases. It is prescribed at 500 milligrams twice a day for 5 to 10 days, depending on the course and specific location of the condition. Now, regarding children, for children, rinsing the mouth is recommended. You can actually prepare a decoction yourself using chamomile, lemon balm, and wormwood. So we steep this mixture about 1 to 1, and you can dilute it a bit with water so the concentration isn't too strong. Let it infuse, and then rinse the mouth once or twice, because wormwood is bitter and, well, it will be quite unpleasant for children in the mouth. Also, treating the area with fir oil or sea buckthorn oil is very effective. It promotes healing very well and is excellent for helping ulcers close up. You can also apply it every 2 to 3 hours until the area heals. The mucous membrane heals quite quickly. Aloe juice is also an excellent remedy. It can be safely applied inside the mouth, used to coat the affected area, and even swallowed. There's nothing harmful about that. That's it. Tetraborate is borax with glycerin. It also promotes healing very well, but it should be applied to external surfaces, mainly when the affected area extends to the lips or the corners of the mouth. In those cases, it works wonderfully for healing. However, it's not really recommended for use on the inner mucous membrane of the mouth. So how do we treat herpes on the tongue, aside from antiviral medications? We also prescribe gels and ointments which are applied directly to the tongue when it's very painful, both to relieve the pain and to address the symptoms. And of course, at the same time, we need to fight the virus itself. That is, ointments based on acyclovir, such as Asic, Zovirax, and also Fenistil. Fenistil in general also helps relieve pain and similar symptoms. There's also a medication called Vivorax. Tableted medications can also be used, for example, a cycloferon tablet, right? It also acts as an immunomodulator, and you can place it under your tongue. But the most important thing is to make sure there are no erosions under the tongue and that there isn't increased bleeding. The advantage is that it is rapidly absorbed directly into the bloodstream, and you can see the effect right away. So about 5 days is enough, and you'll already see good treatment results. For pregnant women and children with herpes on the tongue, the medications Viferon and Anaferon are also recommended. Anaferon can be given to children in the form of suppositories, so it's less traumatic for them. Aloe juice. Aloe juice is an excellent remedy. It not only promotes healing very well, but can also be used as a drink, serving as a general immune booster and a biogenic stimulant. Lemon balm infusion also works well, as does calendula oil and tea, especially those rich in vitamin C, like blackcurrant and raspberry leaves. You can also steep rowan berries and cranberries, wonderful. This all helps to boost immunity. As for herbs, you can even just rinse your mouth with an infusion or decoction, like a decoction or infusion of calendula and sage. They work well on the mucous membranes of the oral cavity and also on the tongue.